Hi, I'm Dr. Epstein, and I'm here to answer a video by video, a question submitted by an interested individual named Adrian. Adrian's question is basically relates to the fact he's had several scalp reductions, and as a result of those scalp reductions, what he's concerned about is he's had some elevation of the hairline above the ears. This is a problem I've encountered in the past. They were more common with the more aggressive scalp lift procedures, which were very popular in the, I think it was in the late 70s to, mid to late 80s, where basically the entire scalp was brought up through these very aggressive incisions made throughout the temple and all the way along the top of the head, and the entire scalp was elevated, and as a result patients would get a significant elevation of their hairline above the ear, such to the point that it would be, instead of being located right at the top of where the helix is of the ear, it would go all the way up. These are repairable. I've had the opportunity to do some of these repairs, and essentially it's with the technique of hair transplantation. Hairs will grow in this stretched skin, and really it's a matter of how the hairs are obtained can be done by the strip technique or by the FUE technique, or the follicular unit extraction technique. Both techniques are very effective for achieving the adequate number of grafts that we need, depending on the amount of elevation and therefore the amount of lowering that we're going to be doing. It would take anywhere from around 50 or 60 to as many as 120 or so grafts per side. So you're talking about a 200 to like a 300 or so, 200, anywhere from like 100 to like a 200, 250 graft procedure. Much more likely to be somewhere around 100 to 150 grafts. Easily done with follicular unit extraction or by the strip. A small single donor site incision would be sufficient. The hairs, the key thing for achieving an aesthetic result, need to be implanted at the proper direction. You don't want them sticking straight up, but you want them following the natural direction of hair growth. And I would expect, and patients could expect, at least 90+% rate of growth, typical for transplanting in any non-scarred area of the scalp. Anyway, this is Dr. Epstein. I hope that was a sufficient enough answer. You can see some examples of these different type procedures on my website, and I'm sure throughout other websites that are available, for those who are looking for IAHRS doctors. Thank you.